The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Shoulder Pain by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. Today we're going to be discussing shoulder pain, what it is, how to treat it, and how to diagnose it. We're going to give you some simple self-diagnostic tools as well as some simple home treatment recommendations which may save you the initial trip to the doctor's office. First of all, what is shoulder pain? Obviously, this is a very broad topic encompassing everything from shoulder arthritis to rotator cuff tears to biceps tendonitis to labral tears and everything in between. So what we need to do is drill down to what is the source of your pain, and hopefully this video will point you in one direction, and then you can watch the other sub-videos which go into more detail regarding the specific pathologies. So shoulder pain due to arthritis is going to be something that we see occasionally, but it's not going to be the most common source of shoulder pain that I see in my clinic. Patients with arthritic pain typically are going to be in their 5th or 6th decades of life or beyond. They're generally going to have pain popping and crunching with the shoulder as the surface of the joint is worn away. Bone spurs are starting to develop, and that tends to cause some popping and clicking. And very often they're going to have limited range of motion, sometimes severely limited range of motion compared to their other shoulder. This tends to come about slowly, typically over the course of 5 to 10 years or more. There is osteoarthritis, which is wear and tear arthritis. That is the most common type of arthritis that we see. There's post-traumatic arthritis, which is very common in the shoulder, actually. And then there's rheumatoid arthritis and the family of inflammatory types of arthritides. Patients generally will have pain deep within their shoulder with that. For rotator cuff pain or rotator cuff syndrome, again, this itself comes in a broad spectrum from rotator cuff tendonitis with associated bursitis all the way up to a full thickness rotator cuff tear and anywhere in between. These patients tend to have pain that radiates down the arm. Sometimes it's felt mid-arm. Sometimes it radiates all the way down. Rarely does it ever radiate up the neck. It tends to be very commonly bothersome at nighttime. Sometimes patients have profound weakness with this, particularly if they have a full thickness tear of a major portion of the rotator cuff. Sometimes it's difficult for them to initiate lifting the arm, although once they get the arm up and overhead, they're generally able to hold it there. The deltoid muscle takes over and is able to hold the arm up and overhead. But then as they're lowering it, when they get about here, usually the arm will give out. The pain tends to be felt sometimes more towards the front of the shoulder as well, and typically in the upper third of the arm. Biceps pain can be felt in a very similar area. The biceps muscle lives in the front of the arm, and it turns into tendon, which comes up and wraps up inside the shoulder. So anterior shoulder pain or any popping or clicking in the front part of the shoulder sometimes is associated with either biceps tendonitis or biceps pain, or sometimes that biceps can become unstable and pop in and out of its groove. The biceps comes up and wraps around and inserts on the top of the shoulder socket, and around that socket is a layer of bumper cartilage called the labrum. It makes the bone socket deeper. The biceps inserts up here at the top of the labrum. So if the biceps is torn or inflamed or frayed, sometimes it can pull a portion of that labrum off or inflame the labrum. And so there's a lot of overlapping symptoms between biceps and labral type symptoms. The small joint of the shoulder, called the AC joint, is where the collarbone comes out and ties in with the shoulder girdle. It's the bump typically that you can feel at the very top of the shoulder. Some patients have very, very prominent bumps here, and other patients it's very subtle. But in patients who have arthritis or inflammation of the AC joint, they tend to have isolated pain right there. So you can palpate over that area as a self-diagnostic tool. Other self-diagnostic tools include palpation at the rotator cuff insertion. Oftentimes patients will have pain there where the rotator cuff inserts up high, although sometimes the pain is felt further down the arm like we discussed. The biceps tendon, you can feel the biceps muscle and then just kind of go straight up where the tendon inserts in the shoulder, and oftentimes patients will have some tenderness there along the long head of the biceps tendon with biceps tendonitis or biceps pathology. Another test that you can do for rotator cuff strength would be hold the arms out, turn your thumbs down, and have someone push down on your arms and check one side compared to the other. If one side gives out, that's checking the supraspinatus portion of the rotator cuff, which is the most common area of injury and area to be torn within the rotator cuff. So check for strength of the supraspinatus portion of the rotator cuff.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.